Possibilities are all around us. Everywhere we look, we see opportunity.
All right.
In unexpected
Can you hear me?
places. And when we share our knowledge, vision, and connections, we turn great ideas into action in communities all around the world that we call home. Like transforming an old bus to feed hungry
Xavier?
children, or providing life-saving equipment to those who need it most. From fighting disease to rebuilding schools, together we can make real change happen. We're Rotary. We are people of action. Get involved today at rotary.org/action.
All right. Well, we're live, and I'll hand it over to our club president, Richard Diaz.
Awesome. Thank you, Xavier. Hello, everybody. Welcome. Thank you for being here. We had a little bit of problems, but we got everything situated. Thank you for being here again. We have a panel of mental health professionals, and they've put together something nice for you. I hope you enjoy.
All right. So this evening, I think we're gonna have a very informative session. We have some outstanding panelists with us from a mental health perspective, and I will go ahead and gladly introduce our great panelists. So first up, we have Mary Rivera, who's a licensed professional counselor, a licensed chemical dependency counselor as well. She's the founder of Lucid Counseling and Wellness. She has worked with individuals, couples, whole families, and individuals with physical and cognitive disabilities. She is a nationally certified trauma-focused cognitive behavioral therapist provided by the Trauma Institute. It is a specialization focusing on children, adolescents, and teens who have experienced a significantly traumatic event. Additionally, she is a certified cognitive behavioral therapist, which treats depression, suicide, anxiety trained, and she's anxiety trained by Aaron Beck, the father of cognitive behavioral therapy, the founder of the Beck Institute. Lastly, as a level 3 Gottman trained clinician, she specialized in helping couples learn to communicate, rebuild friendships and passion in their relationship, and assist with repairing relationships from an affair or other attachment issues. So welcome, Mary. Next up, we have Rick Edwards. Rick is a licensed professional counselor, and he's Clarity's director of inpatient services, and he directs the acute, residential, and partial hospital programs. He has worked at Clarity CGC since 1976. That's 44 years. He has provided individual and family therapy to countless children and adolescents. His experience includes supervision of counselors and interns, as well as training psychiatric residents. Mr. Edwards' clinical interests include perpetrators of abuse, self-injurious behavior, family dynamics, and anxiety disorder. Welcome, Rick. Thank you for joining. Next up, we have Whitney Tolson, MA, LPC. She's a licensed professional counselor with over 10 years of experience working in the mental health field. In June 2019, Whitney founded the Alamo Ranch Counseling and Wellness. As the owner of Alamo Ranch Counseling and Wellness, Whitney has more time to focus on areas she is more passionate about and provide people with solutions and tools that are creative and unique to them as individuals. Whitney works with many individuals struggling with anxiety, depression, trauma, and she specializes in working with teens and pregnant and postpartum mothers. Whitney has an advanced training in eye movement desensitization, reprocessing. I know it better as EMDR, and perinatal mood and anxiety disorders. So first off, thank you for joining Whitney and the rest of the this great panel. I know we're excited to learn more. 2019 was definitely a year to remember, and so I know a lot of folks are gonna log in on here and figure out what tips can they use to get through some of the the events that they've experienced over this past year. So it's been a rocky road. Let me go over here real quick. So first, Whitney, I want to call on you. And what I'll do is I'll ask a few questions here that will kind of guide the discussion. Feel free to spend, about maybe 2 or 3 minutes answering each question. But my first question to you, and I'm trying to bring up my slide here. All right, where are we? Pardon me, I'm here. All right, so my first question that I'll ask is, what are some ways that people can kind of come down off of this wild ride of a year with COVID-19? What are some techniques that they can use to kind of really get back into the groove of normality? And so any of you can kind of start with that question, just some helpful tips if you don't mind.
Okay, well, I'll go first since I unmuted my mic. Some tips I would suggest would be, first, take your time, because this past year has been somewhat traumatic for many of us. And when I say traumatic, I mean very triggering, just things changing left and right. So really, whatever normalcy you want to get back to, I would take my time, because things are still ever changing. So just being aware of your triggers, knowing what makes you comfortable, communicating with others, letting others know that if you're feeling triggered, maybe I'm not going to go to that cookout, or what can you do to make me feel a little more safe? So those are some things that come off the top of my mind.
Thank you. And so I'll start, and I'll also ask you the question. So tell me a little bit about you and what do you do, Whitney, as an LPC?
Okay, so I'm a licensed professional counselor in Texas. So that means that I'm able to see clients throughout the state of Texas, providing them services to help manage anxiety, depression, life changes. Specifically, an area I'm really passionate about is working with moms. I do work with teens, but since I've become a mother, I've noticed that things change a lot. And so helping moms adapt to motherhood is something that I'm really passionate about. I help them process the beliefs that they have about themselves. Sometimes we go through life and we create beliefs and belief systems. And I really help them break that down, because sometimes those beliefs are not healthy and they're not helpful. So understanding which beliefs are actually helping me, which ones are maybe irrational, and kind of going back and looking at those things to help them move forward.
Well, thank you. I'll call on Mary next. Kind of like a double question, coming off of a crazy wild ride this year with COVID-19. What are some, maybe 1 or 2 tips that people can use to kind of help them get through and onboard into a new norm? And then a little bit about yourself as well.
Okay, so a little bit about myself. I primarily work with couples. One thing I did notice working during the COVID, I've seen an increase in couples. I help couples kind of manage communication. I help them work through infidelity issues. And I also work with children, primarily through those that have experienced traumatic events. So I get a lot of children that have come from families that there was domestic violence or have experienced neglect or abuse. As far as tips, I would say, I agree with Whitney. You have to move back slowly, not jump into it automatically, especially those that already struggle with anxiety or some mental illness. So I would definitely say to start off slow, not jump into the community too quick, and just take your time and give yourself that space, because people are going to say, you know what, just go back in. There's nothing to worry about. Just go back to work. But I agree with Whitney. You kind of have to take your time.
Absolutely. I think we definitely learn to be a little bit more patient with ourselves, not having as much control as we would have liked this past year. Rick, what about you, sir? Coming off of a crazy year, and a little bit about yourself.
Sure. I work in an inpatient psychiatric facility for children and teens from ages 3 to 17, but I also work then with their parents. And I oversee about a dozen other clinicians that provide the same service. And, despite, the sense of quarantine, we had inpatient kids that were here with their families. We did a lot of telehealth, but we also had a lot of kids and families that were here that struggled just with one end being shut down and restricted to homeschooling, maybe some job losses. And now we're kind of on the flip side of people trying to get reintroduced back into a kind of a normalcy. Both of those were just extremely anxiety producing. So the quick tip that I would offer is there are two sides to this pandemic. And one side of it is it kind of brings out the warrior part of us. And I don't mean warrior in the way of getting into fights and fighting a battle, but it's the one where we kind of stiffen our spine and get up to do some of the hard work, the difficult work that it takes to be there for our kids and for our family and even at our work. And the flip side is then the need to be a caregiver, and a caregiver to ourselves, to know when to take it easy, to show some self-compassion, and know that you have to be able to renew yourselves. We don't often get to choose the times when we get to do that, but it's important to remember both sides of that coin.
Great, all great points. Thank you all for sharing. Patience, I hear that theme. I hear that, taking it easy with yourself and allowing yourself to kind of ease back in and getting to know yourself kind of all over again. I think there was a little bit of some pros and cons that happened with this experience. I think with it, we got a chance to really get to know ourselves on a deeper level. The busy life kind of slowed down quite a bit as well. But how do you define mental health? What are some ways that you define mental health? And I'll start with Whitney.
Okay, so mental health, one way I would explain it is kind of like, if you think about physical health, it's like our mental stability, our ability to maintain resiliency or to be resilient, our ability to overcome things, how things are impacting us. So we're not going to go through this life and not be impacted by things, but how do we respond? So mental health is looking at your thoughts, your emotions, and your behaviors. A lot of times, or we can't see people's thoughts, but we can see how they respond. We can kind of guess how they feel depending on their facial expressions. But then you have people that can smile and still feel a certain type of way. But really just paying attention to all those things, paying attention to what type of thoughts am I having? How is it making me feel? What behaviors am I having, and how is it impacting my relationships? How is it impacting my self-esteem? How are these things impacting my quality of life? So I think that's a way to explain mental health from my point of view.
Well, thank you. I think that's a great defining aspect of mental health, and so I'll pass the baton to Mary. How do you define mental health?
Okay, so to piggyback on Whitney, coming from a CBT approach, same thing, mental illness, it's kind of like a person's way of thinking, which impacts how they feel. And it's also going to affect how they behave or affect their moods, but with mental illness, the way I describe it is it has to impact like multiple domains of a person's life. So if it's affecting like the person's relationships to family, to their significant other, if it's affecting their work, if it's affecting how they participate in the community, so it has to kind of affect the whole, domain of the person's day-to-day living. And so that's how I define mental illness coming from a CBT approach.
I love it. How about you, Rick?
Yeah. For me, I kind of frame mental health as a really a balancing act that takes place, that we know in life there's just going to be struggles and they're going to throw us sometimes for a loop. This past year has been a perfect example of that. And it's how we learn to kind of walk that tightrope and continue to balance ourselves, sometimes needing a little bit more support, maybe even taking an opportunity to stop and kind of collect ourselves and remember that, you know, the more we can stay in the present rather than kind of focusing on what's in our past or what lays ahead of us, but just be present in the moment, that can help balance that whole issue of mental health. Knowing, you know, full well that there are going to be some tough times, but there are also enjoyable times, and to learn in many ways to appreciate both from the point of view of this is a way of striking some balance in our lives in order to be there not only for ourselves, but for others in our families and our careers.
Absolutely, absolutely. That's so great. All great responses, and I'm sure a lot of folks who are going to view and are viewing now, these are all, you know, there's a stigma around mental health a lot of times, and so I think once people learn a little bit more about what mental health means and how, you know, licensed professional counselors can assist with getting through those rough points of life, I think the more palatable it starts to be okay to say, hey, I'm going to go see my therapist. I'm going to go see a counselor. So thank you for defining what mental health means to you. What are some signs and symptoms that someone needs to seek a professional? And we'll do this thing counterclock. So go ahead, Whitney.
So going back to kind of what we were talking about earlier, I look at their behaviors. And so I guess noticing change, and if it's a negative change or if it's having a negative impact on your outcomes in life and ongoing, either 2 weeks or more. And so when I say 2 weeks, I'm not a doctor, but a lot of times if you have a cold, you know, they say, come and see me after 14 days if it resolves itself, because we all do have internal tools, and sometimes we don't need a therapist to help us resolve some things. But if something's happening and it's like an ongoing thing and you recognize how it's impacting you and your outcomes, that may be a sign that you can get some help. Sometimes family members or close people will tell you, like, hey, something's going on, you know, or they'll ask you. So that may be a sign too, because sometimes we can be out of it and have no awareness. So paying attention to our behaviors, paying attention to how other people are responding to us, those may be some signs that something's going on. And if it's going on for, you know, longer than 2 weeks, maybe consider getting help, because we're all going to have those days and those times where we're just not feeling it.
Great. That's no, I think that's great. You know, definitely knowing the signs and symptoms that you or someone else may need help are vital, because we're living this life. I think most of us, this is our first time here, right? And so we lean on each other to kind of give that feedback on what's going on, maybe with us or with other people, and also kind of being self-aware if we can, and then also having grace with those folks. So, Mary, what are some signs and symptoms that you would say someone needs to seek professional help?
So I always get asked that same question when I get someone calling to seek help. So they always ask, you know, I have a son that has symptoms of depression, but I'm not sure what it is. So one thing I ask them, like once they come into the first appointment, I do let them know, you know, if you start noticing that they're starting to isolate themselves, if you start noticing that maybe they're sleeping too much, maybe they're not sleeping enough. Another sign and symptom is they start to call into work. That's one thing I notice a lot. They start calling into work a lot. That's definitely another symptom. But also to have that support of the family, that they're kind of aware of each other's behaviors, their emotions or feelings. And so I think just even listening to family members when they say, you need to seek help and I can support you and I can help you. But there's just so many different symptoms. You know, I know more about depression, so those are the ones that I usually treat. You know, another feeling that some people with symptoms that need help are the ones that are stating that they just don't want to live anymore. You know, that's the number one thing where I'm like, okay, we need to get you some help.
Thank you. Thank you so much, Rick. And if you all want, we can always, skip around a little bit. If you don't want to answer each question, we can do that as well. But Rick, I'll throw this one to you as well, so we can get your take on signs and symptoms that someone needs to seek some professional help.
Particular in the field of working with kids and teenagers, the one piece that I'm often so struck with is parents can sometimes misread that and say, well, it's nothing. And for kids, and particularly very young children, and even into adolescence, their lack of experience, and sometimes particularly very young kids, their inability to put those things into words makes it really, really crucial that parents are aware of that. So, as adults, if something kind of went sideways for us, we would have enough experience to say, yeah, okay, this is not good, and maybe I need to do something about getting help. Very young kids don't know that this is a bad thing. They know it feels bad, but they're not sure. It's like, well, is this the way it's supposed to be? Or is it going to stay this way from now on, or whatever? So parents have to kind of zero in and say, hey, this is not the kind of normal kind of response. And to let them know that there are words for it. So we see a lot of very young children that are acting out quite a bit, partly because they don't have the words to say, I'm really upset, I'm really angry, I'm really sad, I'm really scared. Giving them a vocabulary, helping them to put that into words, is a crucial step then towards saying, hey, maybe this is more than just kind of a passing phase for this child. When you see teenagers who, aren't doing and aren't engaging in the kinds of things that they would normally do and enjoy, or maybe even complain about the fact that, hey, the schoolwork is really challenging, now say schoolwork really doesn't matter, it doesn't make any difference anyway. Those are signs, just like Mary and Whitney pointed out, to start paying attention to, hey, maybe there's more here than just kind of a phase for this child, and it would be worth investigating. We often get a lot of referrals through school counselors and pediatricians who say, hey, I've known this kid for a long time and it just doesn't seem right. And it may be hard because it's like that slow boil for a parent who doesn't see the changes that are occurring that are kind of intensifying, but someone from the outside might look and say, hey, this is a presentation that warrants some additional help.
Thank you so much. Yes, Whitney?
I want to add to that because Rick touched on a really good point, that a lot of times, it made me think that a lot of times we can attribute things to just being a teenager. And it made me think, when I'm working with moms, a lot of times people attribute to, oh, it's just pregnancy hormones, or, it's normal not to get sleep after you have a baby. But a lot of times these same things are actual symptoms that something else is going on. So you do have to pay attention to it, because if you're not getting enough sleep, that's just going to heighten your anxiety, and, things can continue from there. So I do think sometimes we tend to gloss over things like, oh, they're just being a teen, or, oh, she's just had a baby, or hormones. And we just really need to pay more attention to people, when they're giving us signals, if they're communicating it verbally, or if their behaviors are showing you something's going on. We as people, a society, we have to pay attention, because that is communication.
Absolutely. Absolutely. And can I ask you, just to kind of piggyback on the back of that, I guess being in tune with ourselves, but also being in tune with our loved ones as well is vital, right? To really recognizing those signs. So stopping, understanding and paying attention to our loved ones and ourselves on what changes are happening. There's a question from the audience. I'll bring it up here. Someone's asking, Abrika, she's asking, what local mental health resources are available for the uninsured? Does anyone on the panel know of any recommended resources?
Go ahead, Mary. Go ahead, Mary.
I know it's not for Bexar County, but there's a place in Atascosa County that they have a sliding scale. So just looking for any doctor and requesting, do y'all offer sliding scale fees for counseling for the uninsured? And
Right.
and usually there's grants that each county has that sometimes they don't pay anything for therapy. I remember seeing quite a few clients that didn't even pay anything for counseling because they were on that sliding scale fee along with the grant that was in that county.
Oh, perfect, perfect. Anyone else care to share any resources that are available for the uninsured?
I was just gonna say, Mary said a good point. Like sometimes just asking people, because I think I know as LPCs, a lot of times they ask us to, do some things pro bono. And so there may be some private practice therapists, if it's someone you're really interested in working with, they may be able to offer something. I know UTSA, the graduate program, I went to UTSA, by the way. The grad school there, they have college, they have graduate students that see people at either a low cost or for free. I believe either I think it's St. Mary's that also does it with the marriage and family therapy program. And then I'm not quite sure about the Center for Healthcare Services, because I do think that's our county's, I forget what they call it, but that's like our county mental health
authority.
Yes. So that's what I have. Rick may have way more than me.
Yeah, CHCS, the center really does provide for kids and families that are uninsured. Clarity is a private nonprofit that has part of their mission working with underserved and underinsured families. And we've done that, for like 135 years. So we do have a portion of our care that is just charity care that is for the inpatient stays as well as our day hospital. So, and many times because of our care coordination team, they can actually work with the family to get kids enrolled in Medicaid insurance companies. So, yeah, there's a lot out there.
Thank you. All great resources, and just trying to get the information out. So thank you for that question, Rika. And I think for folks who aren't uninsured, they definitely need that support as well. So great, and thank you guys for providing that. My next question for you. So what are some of the risk factors that play into if someone develops a mental health disorder? I'll start with Mary. How about that?
Risk factors, I would say maybe past trauma, poverty, maybe family members that have had a mental illness also, domestic violence.
And, for me, many times I think the best predictor, particularly about suicide, is a previous attempt. That if that's present, you really want to have your radar up about even if they're in the midst of getting help, it's something that you have to continue to consider as a potential, just because of the first attempt often may seem like it's the most difficult, and then it may become easier. So you want to have the resources then available. And as Mary said, other family members that are maybe struggling, with their own mental health, or maybe have in the past, and certainly trauma is a huge factor that can contribute to risk factors for kids in particular, that a higher number of incidents of trauma early on without treatment raises the risk of all kinds of impacts on schooling, education, substance abuse, just a variety of factors are impacted.
Wow. All great. All right, Whitney, what are some risk factors?
I agree with it, what everyone is saying. Trauma, demographics, certain populations, certain racial backgrounds are at risk. And a lot of times things are due to, the area you grow up in, or, the family passing on some things, maybe your coping mechanisms, maybe you don't have the resources that you need. Example, the person that asked about, for people that don't have insurance. So it's a lot of things, but I definitely think trauma is a big indicator. And then I think that And realistically, we are all at risk. You know, as long as you're living, like something can happen and it can really put you at risk, like working at a toxic workplace, you know, a car accident. So I think everyone's at risk, but I think higher risk could be like we talked about, and genetic things too. So.
Wow. So multi-layers, right? Just different areas, environments, and the build of everything could contribute to it. We kind of talked about COVID-19 initially when we were first kind of on board into this segment here. But specifically, a question to you all is, you know, how has COVID-19 impacted mental health? Um, it's a wide range, but I'll just open the floor. Whoever wants to take it first.
You know, unfortunately, I think what I've seen in just this past year was such a spike in the level of anxiety in children. And having worked with kids for, 40 something years, this is probably the single most impactful year from the point of view of kids younger than teen feeling suicidal. That it's not unusual for us to get admissions almost on a daily basis of a 8 or 9 year old who you would be thinking might be struggling with, aggression or maybe inattention, and it's coming up suicide, and they're thinking about that because they are so on edge around just life in general for this past year. So it's really just been earth shaking for kids, but for entire families. On top of, you add the grief that families are experiencing with loss of family members, loss of careers, loss of the ability to get to school and to socialize. So to me, that is one of the hugest shifts I've seen in the way of just the difficulty that this pandemic has caused. On the flip side, I've seen families become so much more compassionate in some ways to try and better understand why this might be happening and to take better care of themselves because they know that life can be so fragile. And it's just been an opportunity for frontline mental health folks to work side by side with families around that. And that's, to me, is just a huge, tremendous reward.
Wow. Absolutely. How about you, Mary? Well, I'll go with Whitney. How about you?
Yeah, I've seen the anxiety. I've seen a lot of social anxiety with some of my clients. Just how do I engage with people? Fear of, getting sick. I think Rick touched on grief and loss, like in many ways, like some people lost lives and lost loved ones. And then some people lost, the routine and the safety that they had prior to, lost jobs. And then, so trauma, I know I keep saying trauma, definitely. And just people being in flight or fight or even freeze, like just being on edge or becoming maybe depressed and hopeless. So those are some of the things that I've noticed and some of the people that I've been working with.
Thank you. Thank you for sharing. How about you, Mary?
Well, it's definitely impacted mental illness, but if you think about those that might have already been struggling pre-pandemic, just add COVID to that. And so symptoms are worsening for especially those with depression. You'll see, I've noticed a substance use increase with a lot of my couples because, maybe one was depressed, the other one had a substance use, and it's just getting worse, so it's really impacted. COVID's really impacted a lot of my couples with, pre-pandemic mental illness.
Wow. Yeah. So definitely intense, but and I like in the beginning how Rick kind of talked about, compassion and how it kind of brought families together or brought people together because we witnessed so much loss and you just kind of want to hold on tight and keep each other protected. But then on the other side of things, it's the social anxiety, it's the getting back out there phase because now everything's kind of returning to normal. But at the same time, this is a new normal. So it's like a new way of living, right? But thank you so much for sharing how COVID-19 has impacted mental health. My next question for you, what are some of the things you noticed in your practice that has changed within the past year? And that kind of ties into the COVID-19, but maybe they're talking the way you work, the way your clients reach out to you. What are some ways things have changed in your practice?
I'll go. So March of 2020, let me say, I went in person in January. I got me a little office. And then March, I was out because of the pandemic. And I've been completely telehealth, meaning doing sessions online since then. So that's a major change for me. I actually love it. But I do know some people, you know, they do want to get out of their homes, especially if they've been in there for over a year. But that's a big change. One thing I've noticed, I would say, along with COVID, last year was very triggering for a lot of minorities, especially the African American community, due to some of the social injustices. And I've noticed an uptick in African American clients reaching out to me over the past year. So not only are you dealing with COVID, but you're dealing with other things that are very triggering, and that I noticed with the African American community, which I'm very glad, because I know that's also a community. Some minority communities don't always seek help due to certain cultural norms. So that's something I noticed.
Absolutely. Absolutely. Because we were all kind of glued in on our screens. We weren't going out on our busy days, and we were locked in. So we saw the news, we saw social media. So thank you for sharing that. How about you, Mary? What's some things that have changed in your practice over the last year?
I'm kind of jealous because I never had the opportunity to work from home like everybody else did. So COVID never impacted the practice. Actually, I went full-time private practice in November, and I continue to see clients face-to-face. And I still see clients face-to-face. It's very rare that I see clients through televideo. But I've always practiced CDC guidelines. You know, I take temperatures, I wear a mask. I'm very OCD. So at private practice, I know that my office is going to be clean because that's just me. I need to keep it clean just to, you know, protect myself and protect my clients. One thing that has definitely impacted my practice due to COVID is I've seen an increase in couples counseling. Before COVID, I would see maybe one or two couples a month. Now it's increased to about 8 to 10 couples a month. So, and it's all because they're working from home. Husband and wife are together 24/7. And I have husbands telling me I don't have any space. She's just always there. So, you know, I definitely an increase in couples in the practice.
Right. Great deal. Thank you for sharing. You know, arguing over who ate the last of the peanut butter is a big deal, you know, so.
Or who didn't replace the toilet roll.
Right. You know, it just gets down to the fine hairs, you know, and things. But yeah. How about you, Rick? What changes have you seen in your practice?
So we're an inpatient facility, so we had inpatients, and our outpatient side of the campus actually went fully to telehealth, and they continued for up until recently. And actually they saw kind of an increase, partly because I think families recognized just how much strain there was in the use of telehealth for them. And so that was in some ways a kind of a benefit from the fact that families getting some services. On the inpatient side, we continue to see patients that were in genuine crisis. What we had to be a little bit more mindful of is how families kind of interacted. And so we had to be stricter about visitation and temperatures and masks, which added just another layer of strain to families that were trying to work through stuff. And you had to have some distance, whether you had them on telehealth or only one parent could be in the office at a time to do the family sessions. And then the larger piece was then worrying about your coworkers who were worried about their own health because they were physically having to be present, wearing masks, wearing face guards, gloving up at times, simply to be able to provide the care for the kids and the teenagers. And then worrying when you leave work that what you might take home. So it was just this constant kind of struggle. So one of the things that we did a lot of last year that I really was very pleased with is we would have spirit days and spirit weeks where we would just do something goofy. So one week we had superheroes week, one day we had pajama day, we did sports teams. We did, and got the kids involved, and parents kind of looked at us a little like, what are you doing? But it kept people's spirits up to remember what they were there for to begin with. So it was just if there was a benefit to that, it brought folks, again, I thought, closer, and not just families and kids, but the people that you were working alongside. We lost workers. We had deaths in our facility from COVID because of the work that they were doing. So it's been an up and down, but it was such a privilege, and for me to work with people frontline, food service, maintenance, to work with people that came in every day and showed up knowing that, they were here they had a mission. So a really tough year, but a really rewarding year too.
Well, thank you. Thank you for that perspective. And it's always good when you can kind of break down those walls and break down those barriers and be human, right? Dress up, have fun, just get back to life, right? And so very much needed. So right now we're streaming to Facebook and YouTube. And I think for a lot of folks, they're all, glued into social media every day, all day. Me personally, I try to step in maybe once or twice a week. But how has social media impacted mental health over time, right? How has social media impacted mental health?
Okay, so I will say, wow, it has changed a lot of things. I think I'll start off with some of the maybe not so positives. So comparison, I think they call it FOMO, fear of missing out. And it really does create, like when you see people that look like they're living their best life, because that's usually what people are going to post is the positive stuff. And you start to look at your life and it's not measuring up. It can kind of make you feel like either you're missing out, feeling less than, can create some shame. I would say some people are aggressive on social media. So people may put things out there that trigger you. People may do things to actually get a rise out of you. So just knowing that that's out there, and if you're not aware of it, you can play into those things. What else does social media do? I'm more concerned about it with teens. It can impact adults as well, but teens, it's really, unless the parents are watching, like it's not a lot of filter, and it can be things that aren't really protecting them from exposure to people that may not have positive motives. So those are some things that come to mind. On the positive side, it is a way to connect. That's what they say it was developed for, is to build this sense of community and know that you're not alone and be able to see what grandma is doing if grandma's on social media. But there are definitely some things that can create an area of anxiety and shame.
Wow. All great points. Thank you so much for sharing. Mary?
For one, it distorts reality. That's one thing that I've noticed that it does for a lot of my couples. Because of course, like Whitney said, comparison, you'll have my couples comparing themselves to a couple that's going through a divorce, or where there is infidelity, or, they start comparing, and one partner starts saying like, okay, well, what did I do wrong in my marriage? Why is mine ending in a divorce? And so they start comparing. But then social media can also impact the couple because affairs happen. So that's one thing I've been seeing a lot through social media is messaging old flings from high school, which is causing a lot of infidelity within my couples, because a lot of my couples are working from home, they're in quarantine or whatnot, and it's giving them more time on social media. And so this is how it's impacting, mental illness. It's increasing anxiety. It's increasing trauma, because infidelity causes trauma as well. However, on the good part, social media and mental illness, you see a lot of advertising about therapists and how easy it is to reach out to a therapist. So, however, I tested that theory. Okay, so I reached out on social media trying to find a therapist, and it is the most difficult thing. I reached out to Better Health. You know what? I don't even want to mention. I've reached out to a couple of social media advertisements on finding a therapist. It's been 4 months. No one's reached out to me.
Wow.
Yeah.
Wow.
So I just wanted to test that theory. So the good part, yes, therapists are advertising, but you know, they need to reach back to their clients that are reaching out.
Absolutely. Paying attention to the leads. People need help. And so,
yes.
Yeah, it's definitely brought us, it's closed us into a space where we're viewing. It's kind of like, about 8 years ago, we got rid of TV and cable and things like that. And then social media kind of moved in, right? Because you said, I'm tired of watching the news. I'm tired. But then social media popped up and they make it so easily accessible. So Rick, what's your take on social media's impact on mental health?
Yeah, I was listening just yesterday. Instagram is now wanting to do a version for children. So Instagram Youth was the title of it, so that little kids under the age of 12 can now have access on Instagram, because they were concerned of the content on the Instagram for adults. And it's like, why aren't you just kind of watching your kids not having access to any kind of Instagram at this point in some instances? And I was struck then with the addictive kind of quality that social media can have, that it kind of lures you in with the promise of, you can be popular, and the pressure that kids feel from other kids, and then parents feel that, oh, my kid is going to miss out on something if they're not involved in this, so I have to put them into this. And the next thing you know, it's like you've got now somebody in many ways feeling addicted to that screen. Mm-hmm. And we see a lot of kids that are cyber bullied, and it's not just the in-person kind of harassment that a kid might get in school, but it's online, and it's relentless. So there's pluses, no doubt. And telehealth and having the ability to connect with folks, even from a distance, has certainly been a blessing in many ways for families. But I think you have to kind of be aware that there's such a dark side and an addictive side to it that, you just have to be careful and wary.
Absolutely. Whitney?
I just wanted to say amen to Rick. He said something. The bullying is so different than how we grew up. And I know Rick probably grew up at a different time, but I'm going to say I didn't have social media growing up. And if people made jokes on you at school, it didn't follow me home. Home was a place as my respite. It was a place for me to be safe. But a lot of these kids take their phones home. So they're getting bullied in school. They go home and they're getting bullied again. And it's really taking a toll on them. So I just wanted to add that because Rick touched on it.
That's a great point. It's very true. And from a tech standpoint, they're developing these apps so that you can become addicted to them. And so if you could just go out and hug a tree once a day, you'll probably become more connected with yourself than carrying your device. I just want to throw that out there because it is being created to keep you on. That's how they have value added. They want to make sure that they have 1,000 users a minute on these platforms. And so they're going to do whatever it takes to get you wrapped up in technology. So great points. Thank you all for sharing. Just a few more questions here for the audience. What should someone expect when they book their first therapy appointment?
So one thing I tell people is if you're in the community looking at like a therapist in the community, I would say reach out to a few, several. Don't reach out to just one. I would request a consultation. Most therapists do offer a free consultation, and that way they can kind of see if you guys might be a good match or a good fit. So I don't specialize in eating disorders, so I wouldn't want someone that needs that help to come to me. So that's why it's good to kind of have that initial contact to kind of understand what this person specializes in. Are they able to meet my needs? And so that's one of the first things. At the first session, usually it's an assessment to learn more about you, your past, if you have any other health or mental health things going on. And then usually you go into a treatment plan where you set up goals for therapy. So things that you want to achieve out of this process, and then you start working. That's usually how it goes with my practice.
All right. Thank you. Anybody else want to add kind of how what's the expectation of that first therapy appointment? How does it work in your practice or area? Is it kind of similar along the same lines? Go ahead, Rick.
Well, in our situation, folks have already been in some form of crisis. They're coming through the door because somebody has said your child or your teen needs to be seen and potentially hospitalized. But it's important, I think, when a family comes in, the initial session with the parents and with the child is really to say, hey, first, have you had experience in therapy before, and what was that about? And it's helpful. My advice to parents would be that many times they have kind of an implicit and internal kind of thought about what's supposed to happen here, but they often hold back thinking, you're the professional, you're going to know what it is I might want. So it's important to help pull that out and say, tell me about what you're expecting. So our average stay is about 5 to 7 days. And when a parent brings in, it's like, my child has had this behavior for, maybe months and stuff. So you're going to see them for like 5 or 7 days and everything's going to be great. It's like, yeah, no. This is to help prep you to say, so what is the most important thing that if it was to begin to improve for you and for your child, what would that be, so that we can prep you with the hard work that it's going to take after you leave the hospital? This is to get you through the crisis and to get you back on the road to getting some recovery, not just with medication, but in the hard work you're going to have to plug in to do in therapy.
Okay. Well, thank you. Thank you, Rick. Great deal. Mary, have anything to add to that one?
Mine is a little different. So my initial appointment, especially if it's a couple reaching out, my first appointment, I usually get a history of the couple, to kind of share how they met, kind of just get an overall history. Oral history interview is what I do. And then the second phase, they take an online assessment. After the online assessment, they come back for the next phase. And so I kind of share do a feedback on where the weaknesses and the strengths of their marriage is. And after that, we do a treatment plan. So I kind of share, what interventions we're going to be using. And then that's when that's when therapy really starts, is after the third or fourth phase. So mine's a little bit different with my couples. Since they do pay out of pocket, it's a little different, but those that are under insurance, I do that one a little different too. So it just depends. Private pay, insurance, it just depends on where they're coming from, the couples.
Oh, great. So we're very well-rounded kind of way that you all, set up your operations and how people get onboarded. So one question that people may be wanting to know, especially if you're paying private pay or et cetera, or anything like that, well, how long does therapy last? How long? And especially from men, from a male point of view, I'm not speaking for all men, but sometimes you want to know, okay, I'll go, honey, but how many sessions do we have to do? So how do you answer that? How many sessions or how long does it last?
For me, I give an overall, I just let them know it's between 6 to 12 sessions. We can do bi-weekly, every other week, once a month. It depends on how fast you want to make this marriage, improve. It's really in your hands. If you want to go 6 weeks every single week and you see progress, then it's going to be the 6 weeks. So it really depends on couples, on my case.
And so for couples, if it's the guy, he's probably like, let's do it every day for the next. I'm just kidding. Go ahead, Whitney.
Yeah, so I wanted to add that it will differ depending on each person, because they will have their own unique needs. Some people come in, they just, I just want to touch on my fear of this. I've been to therapy before. I just want somebody to check in with. But then there are some people that have more urgent needs, and not crisis, where we want to get them urgent, immediate help. But, maybe me and my husband are considering a divorce, and this is putting a lot on me. And I just really want to work on myself, focus on some things, because I work mostly with individuals. I don't really do couples work anymore. But yeah, so it really depends on the needs. I think 6, upward, depending on where the person is. If the person has like major depression or something that, may take a while to work through, it may be about 12 sessions. So it really depends on that client's unique needs. But I would say an expectation in private practice, I would say between 6 and 8 sessions is usually like the minimum. When you start to see results, you always revisit your treatment plan. So I go over that with my clients to see what progress we have made, and what do we need to continue to do to get you to reach this goal. So that's something that's important, is for you to kind of see the work you're putting in and the change you're making.
Great. How about you, Rick?
Yeah, for me, the perspective is a little different because of the setting we're in. So it's a 5 to 7 day stay. So we're doing group therapy daily, and in many instances, individual work like every other day, family work a couple of times in that 7 day period. So you get an initial kind of set of goals, and then you want to do safety planning, but you're really trying to prep and get a commitment from the family to do the additional work that it's going to take in outpatient. And when it comes to kids, it really is much more of a, like you said, a 12 to maybe 18 session, and you want to reevaluate. And one of the things that our message on the inpatient side is, you have to be an advocate for yourself and for your child when you're talking to this therapist. And that if you're not getting what it is you feel like you want from them, or that kind of that crucial step to say, if this one thing improved, then you need to maybe start talking about going to see somebody else, or being as forceful as you can to say, this is what I'm going to need from you. If you can't do that for me, can you point me in a direction that somebody might be able to do that? And oftentimes, a parent might struggle with, hey, my child is having these issues. And it's like, we also have to say, this isn't just impacting your child, it's impacting your family. There may be work that has to be done from the parent's perspective as well. And that's, sometimes a struggle. It's like, but I want my child better. It's like, your child might get better if you do the work alongside them.
Wow. Very powerful stuff there. Thank you all for sharing. So, next question for you. Well, I'll just ask you, any tips, for the audience to take with them from each of your perspectives? Any tips, helpful tips along the way?
I'll go. I should have wrote this down because I figured this was coming and I didn't. I would say be more aware of your thoughts, your emotions, pay more attention, and just notice. And then if you notice it's not, things that you want to hear or things that you want to see, and your behaviors and outcomes are not what you want, then maybe look at things you can do to make that change happen. So just being more self-aware, have more self-compassion, meaning self-love, and know that it's okay to make mistakes, and that, you can forgive yourself, have grace. Yeah, I think if you do those things and you focus on being the best you can be, and no one's perfect, I think you will start to notice changes in yourself, and other people may start to notice those things. The last thing I'll say is, if you are struggling and it's going on for more than 2 weeks, reach out to someone. Don't hesitate to get help. As far as I know, you only get to live one life. So just take care of yourself and get the help you need. It's going to help you to help yourself. It'll help your family as well. So that's what I have.
Thank you. Mary?
I'd say reach out to family, communicate with your family. Let them know what you're thinking. Let them know if you need any help. Just have that open communication, and not to hide or isolate yourself when you're having those negative thoughts. Another thing I would add to that is practice mindfulness. That's like a huge thing right now, is practicing mindfulness, which is, of course, being aware. Self-care, definitely, you have to take care of yourself. Not only say we're going to take care of ourselves, but actually do it. Practice that. And that's it for me.
Thank you. How about you, Rick?
Yeah, kudos to Whitney and to Mary both. They hit the nail on the head around it. That's the whole idea around kind of self-awareness and even the notion of kind of emotion regulation and mindfulness. And the point I'll often make is the practice of those is not just about me, but it's the benefit that it has as a result for everybody else. If I can learn to catch myself before I lose my temper, it's going to go a whole lot better for my interactions with my spouse or the kids or whoever else I'm with. And while it may make me feel a whole lot better, it makes everybody feel a whole lot better. And if you can use that, and for me, that the mantra is practice makes imperfect. And I mean, if I can catch when I'm not doing as well as I should be, that's my time to correct. And so if I can be more and more aware of the fact that the days and the times when I'm not doing it well, it helps me get on track quicker and better. And in the long run, it's better for everybody else involved with me and the benefit for myself. So practice until you're imperfect.
Wow. Very powerful tips. I can definitely relate to all of those, and thank you so much. We'll bring up a question from the audience. Rosine Good said, "How do you know when a patient is benefiting from therapy as opposed to just saying what you want to hear?"
So the truth is, I mean, you don't know. I only know what my client tells me, and that's something I tell them early on. Is like, I believe, and I know it's different schools of thought, like you are the expert. You know yourself better than I'll ever know you. I'm the expert at helping you get to the next step. So as much information as you can provide me to help you get there, that's what I'll do. Now, if I notice there's some inconsistencies, I tend to take a more direct approach and just let my client know, hey, you said this, but you did this. Tell me a little more about that. I'm going to challenge my clients because that's a part of the growing is being challenged. And I don't mean like challenging like I'm a football coach, but I'm there to hold you accountable and help you get to that next stage. So I don't know to answer, but hopefully you're not paying your money, to not tell the truth. So that's all I have.
Great points. Great points. How about you, Mary?
So how would I know if my patient's benefiting? I would say from a couple's point of view, I'll hear a little more about the positives in their relationship. So as far as like, oh, by the way, Miss Mary, we actually had date night the other night and we got to know each other even better. So just hearing the fact that they're doing their homework as I'm giving them the homework, that's showing me that they're actually, I see them progressing in the marriage to, it's becoming better in their marriage. The communication's better. They are having arguments. However, they're productive arguments. They're not as, where they're walking out on each other and leaving or breaking things. So there's better communication. So that's how I know my couples are making progress.
That's perfect. That's perfect. So you see the metrics happening, playing out in real life. Great, great. What about you, Rick?
Yeah, I would kind of just echo some of what there isn't a guarantee you're going to know that, they're benefiting. I think some of the work that gets done, particularly with children, and is going to primarily very young children work with the parents, but also if you can join rather than simply saying, I'm going to tell you what it is you need to do and you need to follow it. And then if they're saying, well, I'm doing that, then it's like, oh, okay, so they're better. Is from the patient's perspective, is to say, what is it that you're most concerned about? What is it that's really bothering you the most, or what you feel like you need to maybe change? And then from the flip side to say, so here's my concern for you. And now we begin to invite a conversation where we're doing something jointly. So we come up with a solution that is kind of a combination of what the parent and the child might come up with. And even if it doesn't work even a few times, you're constantly coming back to that agreement to say, can we rejoin again to make fine tune this? Because it's not going to be perfect right out of the chute. But the invitation always remains, I'm interested. I want things to be better for you. And it's not going to be one party has to win and the other party has to lose, that there's a mutual or collaborative kind of approach to problem solving with this. When I hear that that's working, then I can trust that things are better.
Wow. Amazing. Amazing. Well, I think we've learned a lot. I've certainly learned a lot this evening. We did record this session and we're going to keep playing it out there. It's hosted on our YouTube page. It's out on our Facebook page. I just want to thank you all for sharing your time. I know you all have probably seen clients today and you're probably still in your offices. And so I just want to thank you for coming out, spending time with us and sharing your knowledge and expertise on why mental health matters. We covered a range of questions and you guys hit every question right on the head. And so I just want to thank you on behalf of our audience and behalf of our Rotary Club and behalf of our community for sharing helpful tips as we've come off of this tail end of COVID-19 and we enter into a new norm and we deal with social media and just other aspects. So thank you all again. We've had Mary Rivera, who's a licensed professional counselor, Whitney Tosin, licensed professional counselor, and Rick Edwards with us this evening. Thank you again. And next up, we're going to bring Richard Diaz, who is the club president for the Alamo Ranch Rotary Club. And Richard's going to share with us his helpful tips, quick tips from Richard. So Richard, the floor is all yours, sir.
All right. Thank you. Thank you, everybody, again for being here and our great panel of hosts. There was a great diversity of mental health professionals. Gave us a lot of good, quick tips on how to watch out for some of these things, how stress may affect our life, our family lives, our work lives. And I want to just give some tips to help you remain cool, calm, and collected in these times. I know right now these times are definitely cool, calm, and collected is definitely needed. So hope you stick around and listen to the tips. All right, so it's not rocket science that stress affects our whole entire life. We talked about it earlier: family, friends, school. It also has negative effects on our body. Some of those effects can be headaches, dizziness, grinding the teeth, tension, increased heart rate, strokes, diabetes, issues. The list goes on and on and on. So today I want to give you a couple quick and free tips to help for a better you and a healthier you. Today I'll be going over the vet trip salute, why heart and brain cohesion is good, the power of thoughts, benefits of walking in nature, benefits of meditation, qigong, the emotional freedom tapping, and good sleep hygiene. So we'll first start off with the vet trip salute and heart breathing. I wanted to do this the best way I felt, for you to take something home is if we do it right here and now. So if everybody at home, you could do this standing up, sitting down in your chair, at work. Please don't do this driving because I don't want you to fall asleep while you're driving. But wherever you are, if you would take your right hand, and we call the vet trip salute because we salute with our right hand. If you take your right hand, the back of your hand, and you put it on your neck in between your ear and your chin area. If we do this all right now, you take a couple of breaths in through your nose and out through the mouth. I'll take a couple breaths with you, and then you continue to breathe while I give you some of the tips of why this works, okay? So breathe in through nose, then out through the mouth, in through the nose, out through the mouth. All right, and continue that breathing. I'll go over some reasons why this kind of breathing is good. So this breathing, the vet trip salute, is a great way to stimulate the vagus nerve to provide and promote relaxation. The vagus nerve controls the heart, digestive tract, lung function, ability to swallow, and even bladder control. It also affects our mental health. Stimulating the vagus nerve has been shown to reduce stress, anxiety, depression, and even help with PTSD symptoms. The vagus nerve is part of the autonomic nervous system, and it is made up of the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is where we get our fight, flight, and freeze reactions from. It also raises our heart rate and turns off digestion and urination. The parasympathetic nervous system, which we're stimulating right now while we're doing the heart breathing, it helps the rest, relaxation, and the rebuilding of the body. It also slows down our heart rate. One thing about the parasympathetic nervous system is when you turn one on, you turn them all on. All right. Now you could stop with that breathing. I hope everybody tried it and was able to feel a little bit of, because I believe if you take 3 to 5 breaths, you could really feel the benefits of it. Okay, now we're going to try a different kind of different kind of breathing. It's called hard breathing, and the heart breathing helps regulate your heart and brain cohesion. So with this type of breathing, we'll take both our hands and place them over our heart. It doesn't matter which one you put on first or above, whichever feels more comfortable to you. And we'll do the same thing. Take a couple of deep breaths through the nose and then out through the mouth. I'll take a couple with you and I'll tell you why the heart breathing and what are the benefits from it. All right, so breathe in through your nose with both your hands over your heart. Exhale into the nose, and out through the mouth. Now, if you could take a couple more breaths like this while I tell you some of the benefits, please do. So heart rate cohesion is important because it leads us away from stress. Being in stress is like driving through life in first gear. It's good for the short time, but not good for the whole ride. The greater heart and brain coherence we have gives us optimal immune response, optimal biochemical balance, which balances out our hormones, our heart rate, and our cholesterol. Great coherence equals optimal resilience to life's extremes, and it sets us up to better create, handle, and adapt to change. It is also a great way to get us out of our mind and into our hearts, because sometimes when we are in our mind, that's one of the worst places we could be. So this will help bringing it back to the heart. All right, thank you. Hope with that you were able to notice a change in your heart rate, your breath. You might be breathing a little bit. Okay, now we'll go to the power of positive thoughts. So our thoughts create a lot of what's going on. You know, and we have 60 to 70,000 thoughts a day. 90% of those thoughts are from the day before. So who here has heard the phrase, our thoughts create our reality? Well, they do. And so the same thoughts lead to the same choices, which lead to the same actions, to the same experiences, same emotions, same thoughts, and eventually we end up with a negative program hardwired in our system. By the time we were 35 years old, we were pretty much programmed. But don't worry, you're not doomed. Change your thoughts and break the cycle. So, with new thoughts, we're able to create new choices, which lead to new actions, which leads to new experiences, new feelings, new thoughts, and all in all, a new program. And I think Rick touched on this. Consistency is key. So don't just try these things just one time and be like, oh, it didn't work and drop it. You know, try these things for the whole day, for the whole week, for the whole month, and see how you feel. Check back in with yourself. Like some of our guests were talking about, checking in with yourself, seeing how you feel, see if there's any difference from this. So Dr. Emoto shows us proof that human thoughts affect the molecular structure of water. Prayers, thoughts, words, and writing on water containers affect this. So if you see here that after freezing water that's been that words have been spoken to it, like truth, thank you, love, eternal. When it's frozen, it produces a beautiful crystal. And when you freeze water that have negative words or intentions, like "you make me sick," "you fool," "evil," or "before prayers," the water is a totally different structure altogether. And this you can't make this up. So the power of our words and thoughts have an effect on water. And if you know water, the human body is 75% water, the average human body. So if words can do that, what are we telling ourselves, and is it helping us? All right. And another tip is walking in nature. Walking in nature is great and it's free. Here in San Antonio, our city has done a great job preserving some of our natural areas and connecting trails to where we could pretty much reach the whole entire city or any part of the city on a trail. Some of the benefits with walking in nature include improving your physical and mental health, strengthens your muscles and immune system, it sharpens our minds, improves short-term memory, demonstrates de-stressing effects, relieves depression and anxiety, resolves mental fatigue, improves our ability to focus, boosts our immune system, speeds up the recovery after illnesses, improves our performance with creative tasks, this decreases the risk of early death, and it's even said that if you're in nature often, it could prevent cancer. Another thing to check in with ourselves is meditation. And meditations can reduce stress, reduce the production of cortisol, which feeds disease and inflammation. It builds self-esteem, increases the stability of your mindset, decreases depression, increases attention span. The list goes on and on. Um, so doing these things, these free things, is a chance to give you the power to do what you need to do for yourself. And some guests have talked about not having the financial connections to be able to get in to see a counselor. Some of these things you could do it yourself. You do it in your comfort of your backyard, in the comfort of your room. Qigong is another one of those. It's a meditation in motion. Stress elevates moods, improves sleep, activates healing energy, helps clear pain, and a lot of these things, they're helping a lot of the same things. And I'm just giving you a lot of different techniques that you could use for yourself, like emotional freedom technique. You could use these different things. There's a lot of things that take us to a negative point in our life. There's things that school, from the family. And so, just as many things that there is to lower our vibration, I believe that the more things we have to higher our vibration is great as well. So, I wanted to give you these tools just so you could have them. And we plan on, so I didn't go over as deep as I'd like to, but with this presentation, we plan on emailing it to all of y'all so you can better look. And I also have um, some videos at the end that will go more in depth. Another thing is good sleep is critical. We brought it up a couple of times today. Beds are for sleeping, not working. Keep your bedroom quiet, dark, and cool. Turn off devices. Try a sleep focused meditation. And here are some of the videos that will help you dive deeper, and we'll send these to you too, so you have the access to learn a little bit more about the salute, the heart-brain cohesion, the power of positive thoughts, benefits of walking in nature, and meditation. You enjoy what we had today, and just remember that you can't win in life if you're losing your mind. So please take care of yourself. Enjoy. I hope you liked what we had to share.
Well, Richard, I certainly enjoyed it. Definitely thankful for those helpful tips. And like you said, that those are things that we all can do. And as you see, some of our club members said, "Hey, I need to meditate more." So I'm
Yes.
with you. Those are things that we can do in the comfort of our homes and our cars. As we come from work and places like that. Breathing as well. And so.
All
Amazing.
these
Thank you.
things, they're so easy, we just forget to do them. And I like too that that meditation is, it's being talked about a lot more, but I know a couple of years ago, me and you might not be able to talk about it without saying, hey, those guys, where are they from, or what are they doing? What are they talking about? I love it. I love it.
Absolutely. I've taken up on transcendental meditation myself, and it's definitely helped me out a ton. It's definitely brought different perspective to my life. And so I'm grateful to all of these techniques. So once again, thank you so much for sharing. Richard is our club president for the Alamo Ranch Rotary Club. And he is a, can I say Reiki master as well, right?
Reiki master, yes.
Great deal. Great deal. Well, thank you for sharing.
No problem, man. And I stumbled upon a lot of these things just because I was in that place where I was like, I didn't know what to do. My mind was going crazy and doctors were throwing pills at me. I was like, whoa, wait. And these are where I stumbled upon these tips. And I hope everybody just could use them and enjoy the benefits that I've gotten from them.
Absolutely. Absolutely. Well, thank you for your time. Up next, I just want to say thank you all again for viewing our upcoming events tomorrow. If you tune in tomorrow, we have another great event for you, and that's going to be our Healthy Living Disease Prevention Panel. It starts at 6:30. You're going to learn about preventing and managing and treating diseases like diabetes, heart disease, and kidney disease as well. And so definitely tune in tomorrow. You will see that post on our Facebook page, as well as if you're viewing from our website, you'll see the flyer up underneath this video as well. Next up, I want to thank our sponsors. We had Alamo Ranch Counseling and Wellness, Life Point Church, Sisters Care at the Village, HEB, 7 to 7 Dental, Baptist Emergency Hospital. We had Clinical Trials of Texas, the Alpha Kappa Alpha Incorporated, Alpha Tau Omega chapter, SRI, Texas Med Clinic, Cute Smiles for Kids, Southern Roots Vegan Bakery, Laurel Ridge Treatment Center, and the San Antonio Gastroenterology Endoscopy Center. So thank you so much to our sponsors. And once again, thank you so much to our panelists. Thank you for sharing your helpful information with us, your expertise and years of experience with our audience. If you missed most of this, go back to our YouTube page, go to our Facebook page. You can play this back and just receive those tips that they shared this evening. But overall, thank you all again for joining. I'm Xavier Tosin. It's been a pleasure to moderate this. Have a great evening.
Possibilities are all around us. Everywhere we look, we see opportunity in unexpected places. And when we share our knowledge, vision, and connections, we turn great ideas into action in communities all around the world that we call home. Like transforming an old bus to feed hungry children, or providing life-saving equipment to those who need it most. From fighting disease to rebuilding schools, together we can make real change happen. We're Rotary. We are people of action. Get involved today at rotary.org/action.